And welcome back. In today's Health Alert, better care and better results. Doctors at Methodist are working hard to help their patients, and for decades they've been pushing the boundaries of what is possible. That includes life-saving organ transplants. Dr. Vasanthi Balaraman is the medical director of the Living Kidney Transplant Program, and she joins us now. Thank you so much for being here.
Thank you for the opportunity to share some facts about organ transplant and
Great. Well, tell us, first of all, living kidney transplant. What is that and how is it different from a traditional?
Yeah, so there are in general two types of transplants. Deceased donor kidney transplant, which is most commonly performed in the United States, and basically getting a kidney from someone at the time of dying. We procure those organs and transplant into patients who are in need. And living kidney donation or living kidney donor transplants is the other type, where we will take the kidney out from a living donor. Basically a donor who's interested in donating to a loved one, a family member, or a friend, and transplanting it to the patient.
So this month is kidney donation or organ donation month.
Yes, April is National Organ Donation Month.
So what are you all hoping to inspire people to do, especially during this month when there's a greater emphasis on organ donation? How important it is?
Yes, that's a wonderful question. I think I would first like to share some facts about the need for organ donation. There are many people in need for an organ transplant. If I have to give you the numbers, there are about 100,000 patients on the organ transplant wait list, and out of which about 70 or 80,000 patients are just waiting for a kidney transplant alone. So that's a huge list. There are a lot of patients with kidney disease in the United States, a lot of patients on the organ transplant wait list. I think to give it a better perspective, just in Memphis, at Methodist Hospital, we have about 600 to 700 patients on the kidney transplant wait list.
So when you think about that, you have this need, but you also have the need for the people to do the donations. And how is that going? And what is the key, do you think, to make people realize that this is something that's needed and that they can do?
Right. Yeah. So, there are so many patients, and we just don't have enough organs to transplant every patient. We did about 260 transplants just in 2024, but there are a lot of patients still on the wait list, and some people don't see the light at the end of the tunnel. Some people are dying while waiting for the organ transplant. So there's just not enough organs available to be able to transplant all the patients who are in need. So that brings a good point that more people have to come forward to be a donor. We can be a deceased donor. We can sign up to be a deceased donor. We can go onto the state registry or sign up on the DMV to be a deceased donor, where our organs can be used after we die. And we can be living donors. If somebody has a family member, friend, or anybody who's in need, we can be a living donor.
Out big are kidney transplants as part of this? Is that a big area of need too?
Yeah, so as I said, out of the 100,000 patients waiting for organ transplant, 70,000 patients in the nation are just waiting for a kidney transplant. So most people need a kidney transplant than any other organ. And a living donor in general, they have to be 18 years of age or older, and anyone who's healthy, without any major medical conditions like high blood pressure, uncontrolled high blood pressure, or diabetes, and in good mental health, they can be a donor and they can save lives.
And so people may be able to do it. It really doesn't take that much, and being able to save a life is very key to all of this.
Yes, and the process is, I would say that if someone wants to be a donor, we have an evaluation process, and there is an extensive evaluation that goes with the evaluation. We do first of all, when the donor calls in, we have a phone interview, and when we find no barriers, then we bring them in for more testing and evaluation. It takes about 2 to 3 days to complete the evaluation. Sometimes it can take longer, depending on the individual needs. It can take longer. So they'll meet with the team, they'll meet with the transplant physician, transplant surgeon, and there is a whole donor team.
Okay.
There's a dietitian, social worker, independent donor advocate, who are helping them, go through the process, and they will undergo evaluation, which includes some basic blood work, some CT scans, things like that.
So we encourage people, especially during this month, to go ahead and really save a life.
Definitely. And as I said, the evaluation is so extensive, and we make sure it's safe for the donors to donate.
Okay.
So that's the most important point.
Thank you so much. Important information, and we want everybody to heed the call that is out there for this month. We appreciate you being with us.
All right. Thank you. Thank you so much for having me.
All right, Max, how about the weather?